Sometimes having a specially trained police officer and mental health expert on hand is better than a beat cop and a night in jail. I caught up with Officer Austin Guffey. He's a Mobile police detective who's also gotten special training to be part of the city's crisis intervention team. Tuesday, I was with him when he and a doctor from Alta Point were asked to check on a man on the street to see if he needed help. At least while I was there, the man declined any assistance, but it's part of repeated contact they have to try and connect people with the help they might need. Police officials say last year they had more than 2,000 calls from mental health services, and they say that's an undercount. Officials say they can't arrest their way out of this issue.
That's never going to be the solution. In fact, sometimes when they go into, a jail or a prison or something like that, when they come out, their mental health is actually worse.
The clinician is there to help address the mental health needs of a person who may be in crisis.
Ideally, we want a system where when you call 911, it's police, fire, EMS, or mental health. And if there's no weapon involved, that response should be from a mental health clinician.
In addition to wrapping their mental health response vehicle in a new logo, they're also increasing crisis intervention training and distributing more iPads to those officers. If an officer doesn't have a clinician partner from Alta Point with them, the tablet is there to allow them to get someone to talk to the person who may be having a mental health crisis, and also offering counseling in the moment if the officer themselves may be experiencing something traumatic on the job.
A lot of the normal police tactics, may aggravate the situation when you're dealing with the mental health. These officers are trained to de-escalate far beyond what our normal officers are trained to de-escalate.
The Director of Public Safety says it's a chance to take a holistic approach to protecting the public, something officials in Mobile say they're taking seriously.
Our mental health officers will be dedicated to responding to those calls in their precincts, as opposed to an officer who's not trained in CIT.
At Mobile Police Headquarters, Chad Petrie, WKRG News 5.